And now, Dr. Paul Wade on seizure first aid. Seizure first aid. What do you do after someone has had a seizure? Stay with the person until the seizure ends and he or she is fully awake. After it ends, help the person sit in a safe place. Once they are alert and able to communicate, tell them what happened in very simple terms. Comfort the person and speak calmly. Should you let someone sleep after a seizure? Yes, let him sleep. When he has the seizure, make sure he is on the floor where he will not injure himself. If he has been sick and has a lot of mucus, make sure he is on his side so that the mucus and saliva does not choke him. What is the first aid treatment for seizures? Epileptic seizure first aid. Number 1, stay calm and remain with the person. Number 2, if they have food or fluid in their mouth, roll them onto their side immediately. 3, keep them safe and protect them from injury. 4, place something soft under their head and loosen any tight clothing. 5, reassume the person until they recover. Reassure them until they recover. What should you never do when someone is having a seizure? Support them gently and cushion their head, but do not try to move them. Do not put anything in their mouth, including your finger. They should not have any food or drink until they have fully recovered. Should you leave someone alone after a seizure? But you should still not open their mouth during the seizure or put anything between their teeth. It is important to check that their airways are clear after the seizure. Stay there. Don't leave the person alone, even to get help, unless it's absolutely necessary, because the seizure does on for too long. The seizure goes on for too long. How long does it take to recover after a seizure? Some people feel better after an hour or 2, but for some people it can take several days to feel back to normal. A very small number of people find they have temporary weakness or can't move part of their body after they've had a seizure. This is called Todd's paralysis or Todd's paralysis. How long does it take to recover after a seizure? Can you treat a seizure at home? Don't try to hold them down or stop the movement. Place them on their side to help keep their airway clear. Look at your watch at the start of the seizure to time its length. Do not put anything in their mouth. Can hydration cause a seizure? Can dehydration cause a seizure? If left untreated, severe dehydration can be serious and cause fits, seizures, brain damage, and death. Why shouldn't you touch someone after having a seizure? You could chip the person's tooth, or your finger could be bitten. Do not try to hold the person down, because this can cause injury such as a dislocated shoulder. What are early signs of a seizure? Mood swings, inability to concentrate, increased agitation and irritability, depression, lightheadedness, headache, trouble sleeping. Does it help to talk to someone during a seizure? Stay calm. If you stay calm, it will help others stay calm too. Talk calmly and be reassured to the person during and after the seizure. This will help them feel better as they recover. What are the red flags of a seizure? Symptoms during an aura or focal seizure include muscle twitches and jerking movements on one side of the body, a feeling of deja vu, intense anxiety or fear. When should you call an ambulance for a seizure? Only call 911 if one or more of these are true. Number one, the person has never had a seizure before. Number two, the person has difficulty breathing or walking after the seizure. Number three, the seizure lasts longer than 5 minutes. Number four, the person has another seizure soon after the first one. Number five, the person is hurt during the seizure. This has been First Aid on Treating Seizures.